Hello there. I'm Dr. Stuart Ackerman, a gastroenterologist, sharing important information about colon cancer screening. As a specialist in digestive health, I'm often asked many questions about colon cancer screening, but the one I get most often is when should people start getting screened for colon cancer? And this is a crucial question as colon cancer is one of the most preventable yet lethal forms of cancer when not caught early. The good news is that with proper screening methods, we can find and remove precancerous polyps as well as detect early-stage colorectal cancers. So what are the main screening tests for colon cancer? The premier structural exam is the colonoscopy, where we use a tiny camera on the end of a long flexible tube to visually examine the full length of the colon and rectum. Colonoscopy allows us to see any polyps or abnormal areas and even remove polyps or biopsy abnormalities during the procedure. Other structural tests include CT colonography, which constructs a 3D model of the colon through specialized CT scans, and stool testing options like the FIT test and the Cologuard DNA test, which analyze stool samples for genetic markers or traces of blood that could indicate cancerous or precancerous tissue in the colon. These non-invasive tests can be great options for screening, but any positive test would require a follow-up colonoscopy. Now, who should be screened and how often? For average risk adults, screening should begin at age 45. You can choose either a colonoscopy to be performed every 10 years, or a FIT or Cologuard stool test every 1 to 3 years depending on the test. Those with a stronger family history of things like colon cancer or colon polyps will need earlier and more frequent testing specifically done with colonoscopy. Make sure to have an in-depth discussion about your family health history with myself or your primary care physician. If you have a first-degree relative, like a parent, sibling, or child who had colon cancer, or 2 second-degree relatives with colon cancer at any age, you are considered an elevated risk patient. So for those with family history, I'd recommend starting 10 years before the youngest person diagnosed in your family, or at the latest by age 40. After that first colonoscopy, any normal result means repeating the test every 5 years for closer surveillance. Colonoscopy in particular has distinct advantages over other screening modalities. As the only method that visualizes the entire colon, it's the most sensitive test in detecting small polyps and early cancers, things that are often missed by other methods. Plus, any abnormalities like precancerous polyps can be removed immediately without needing to schedule an additional separate procedure. Colonoscopy also allows for tissue biopsy if a cancer is found in order to help determine proper staging and diagnosis. While colonoscopy remains the gold standard for screening, it does have some drawbacks of being the most invasive method, and it requires a bowel prep and sedation during the exam, but avoiding colon cancer far outweighs the temporary discomfort. I would be remiss if I didn't mention that there are also some new advances on the horizon. Exciting innovations aim to improve early detection even more thorough by using computer-aided diagnosis, using AI and deep learning technology to highlight potentially cancerous tissue. Software analysis in real time can point out areas for your gastroenterologist to focus on during your colonoscopy. Multiple studies have shown that adding this AI component during a colonoscopy can boost the detection rates of polyps significantly. Combine that with other innovations in the works like better endoscope optics, molecular testing, and more specialized GI trainings, and we have a credible potential to further reduce colon cancer cases through early screening and prevention. So in summary, no matter your risk level or family history, colon cancer is largely preventable with proper screening practices. I urge all of my eligible patients not to delay scheduling this critically important and potentially life-saving procedure. Let's discuss your history and what screening method and timing is right for your situation. Prevention and early detection are key. My office offers traditional consultations as well as an open access colonoscopy program where you can schedule your colonoscopy directly for those patients in good health without any symptoms. Please check out my website for links and information to help you get scheduled today.